about investigation for H. pylori detection. Okay, so there are two types of test. One is invasive, other one is non-invasive. So under both there are three tests. Okay, so in invasive test we have urease assay, histology, and culture. Okay, so culture. Okay, so in urease assay it is done endoscopic biopsy specimen, that's why it's invasive. Okay. And the specimen is taken from the gastric body and antrum. Okay, and the specificity of this test is 95 to 100%, and this is almost never false positive result. Okay, so and sensitivity of this test is lowered by taking PPI and H2 receptor antagonist or antibiotic. Okay, so this is further modified by rapid urease test kit are commercially available and can detect urease in gastric biopsy specimen within a 1 hour. Okay. Okay. Next is histology. So in histology, this is also performed on endoscopic through endoscopy. Okay, so routine hematooxylin and eosin stain or special stain like silver, Gimsa and Genta stain. Okay, important one. So special stain for H. pylori are silver, Gimsa and Genta. Okay, and sensitivity is 95 and specificity is 99. So slightly more accurate than urease assay. Okay, so histology definitely you are taking the tissue, so more accurate than urease assay. Okay, and additional benefit of doing this test is you can assess the severity of gastritis and confirm the organism in the specimen, and this is bit expensive option. Okay. Okay, the third invasive test is a culture. Okay, so culture the specificity is 100% because you are growing organism. Okay, and it required 3 to 5 days. Okay, culture so required 3 to 5 days. Okay, and it is also provide opportunity to perform antibiotic sensitivity testing. So culture we generally perform this, so nothing new. Okay, next is non-invasive test. So we have three non-invasive tests: urea breath test, stool antigen, and serology. Okay, so first one is urea breath test. So breath, so it's a non-invasive. Okay, and sensitivity and specificity are greater than 95%. So very good. And if the patient is taking antibiotics, so it has to be done after 4 weeks, or PPI if the patient has PPI is taking PPI, it has to be stopped for 2 weeks. So double P 2 weeks, antibiotics 1 month. Remember A for 1 month. Okay. Okay, and since we are taking it's non-invasive, so less expensive, and there are false negative result if test is performed too soon after treatment. So it is also best to perform at least 4 weeks, same as since we are giving antibiotics, no, so they are taking at least you have to wait for 4 weeks to after therapy is completed to do this test. Okay, and the next one is stool antigen. So in stool antigen we look for the H. pylori antigen in the stool sample of the patient, and it is mainly used for detection eradication of infection after treatment. So this is very famous question for eradication of the treatment, which test is done. So it's a stool antigen, and it is very cost effective method for assessing treatment efficacy. Okay, and the last one is a serology. Serology generally we do ELISA and all. Okay, and we look for IgG antibody in H. pylori antibody. Okay, okay, and test need to be locally validated based on the specific bacterial strain present in that locality. Okay, so antibody titer remains high for 1 year or longer after eradication, so cannot be used to assess response of the therapy. So it's not a very good test. So stool antigen and urea breath test are preferred modality for diagnosis and evaluation of treatment efficacy. Okay. Thank you.